So, as I was saying, the issue is the supply versus demand. So you'll find that some of the items there's a high demand, but then the supply, if one step in the supply chain is affected, it affects the whole economy. So if, for example, pharmaceutical companies cannot get the API, the active pharmaceutical ingredient, which is actually the drug itself. So if they can't outsource that, then it means that it's going to slow that the production is going to slow the amount of of drugs that are being produced. It's going to slow. Obviously, the demand is going to get higher because less of the item will be available, which then brings in these dragons that I mentioned in some of my videos. These dragons who are doing these counterfeit medications, these dragons that are doing all of this type of stuff that are available right now in the street. So you gotta be careful where you get. Ensure that you buy from a pharmacy that has a Y number. You can go into the pharmacy and ask for the Y number of the pharmacy, and you can actually check if that pharmacy is registered. Doctors are not allowed to sell medication to the public. However, if a medical practitioner or a specialist has a dispensing license, he is allowed to prescribe and dispense a small amount of quantity to that patient, but he is not allowed to sell a box of Adderall or a box of Rhinex or a box of Pharmacaps or stuff like that to the public. So he's not a pharmacy. His dispensing license is to issue emergency medications to the patient. If a patient has a 6 months prescription from the medical practitioner, then the law wants that practitioner to write a prescription for the patient. The patient can go and get it from a community pharmacy. So that is the thin line between a dispensing doctor and an actual pharmacy. He's not a pharmacy. So now what is happening? The war that is actually taking place in Russia and Ukraine is also has an influence in affecting the supply chain. So you are now affecting a portion in the supply chain, which then causes all of these problems. The USA owns 90% of Big Pharma, followed by Europe, and the Chinese and the Indians. They also own a lot of companies. They're not as big as the US, but they are up there. They also own a portion of the sector. So what happens is some of the molecules that Big Pharma is actually outsourcing comes from certain mountains in countries and in areas surrounding Europe. So that it means there's certain countries that are between Europe, but I can't mention those countries, certain mountains, certain countries that are between Europe and Russia and some in Asia. So now that war is actually affecting because some of those countries are allies with Russia, some of those countries are allies with Europe. So that is also affecting the whole supply chain, which causes a lot of, delay in actually getting the product. So if you find yourself in a situation where your medication that you are taking chronically is out of stock, it's not that particular chain of pharmacy or that pharmacy is not ordering. It's the issue of we are trying to get the best medication for our patients, proper medication from reliable suppliers, from registered suppliers, not counterfeit medication. So there's basically an issue with the supply chain. Okay. And then another issue is once a product is outsourced, it must be manufactured and it has to be tested for quality. So some of the products, they then fail the final stages of that quality checks, and all of that product or all of that batch has to be discarded. So there are those issues, but the main issue which I've picked up is the issue of the war, which is causing a lot of these big farmers to actually lose out on outsourcing those APIs from those mountains somewhere in Europe and somewhere in neighboring countries in Europe and in Asia, and some in Africa. So they're actually having a challenge in outsourcing those items, which then causes a big problem in the economy and actually supplying all the people that actually give it to or sell it to the patients. So there's that issue. What you can do though is to speak to your pharmacist, because you will get a script, you go to a pharmacy, you will definitely be assisted by a pharmacy assistant. Ask to speak to your pharmacist when you get to the pharmacy, and then the pharmacist might then recommend maybe a generic if you are happy with generics. Then the next option would be, if you are not happy with generics, then he can then have a discussion with your medical practitioner, or your specialist, or your physician, whoever is in charge of overseeing your health, and they can now come with other alternatives that won't affect your clinical outcome. Okay, that is what you can do, because some of the things are beyond the pharmacist's control, are beyond the physician's control. So speak to your pharmacist, ask for alternatives, and he must discuss with your doctor. They can put a treatment plan for you, and you can then go into the next line of treatment that will work properly for you.